All right, here we go. All right, good morning, everybody, and we are here again. This is Ron G on WSAN Radio. Yes, we are still here. We just moved some things around on the radio station. We are actually rebranding everything as we speak right now. But my man got a hold of me the other day. They got a lot of things going on. I was at the grand opening on the south side when you had that going on, and everybody was just blown away on finally we got a clinic on the south side, and that is something that we've been needing. I've been noticed lately that the shift is coming because I think there's a hospital being built not too far away, and there's a lot of things going on. But like, okay, now we got to remember the south and east side because we're there, and we appreciate what you're doing. And introduce yourself again and let us know what you have coming up.
All right. I'm Dr. Musa, Dr. Hussein Musa. I'm the founder of the Kingdom Healthcare System. We operate a 501c3 nonprofit on the south side of San Antonio, where we provide free and affordable access to care for those in need. Our primary services are medication refills, health counseling, prayer, and physical examination. And at our clinic, we're able to see patients who have not had access to a physician for some time, or they're in a transition zone where they don't have a primary care doctor, but they know their medications, or they have some health questions, or they just can't get in to see anyone. Our goal is to function as a gap in care and easy access starting point for people who don't have insurance, and even some people who have insurance, but they still want compassionate care where your doctors can care for you, can pray for you, and give you very sound advice. So we're currently open from 10 a.m. to 2 p.m. We're located on the southeast side of San Antonio, 4025 East South Cross Boulevard, Building 1, Suite 5, San Antonio, Texas, 78222. And it's very easy to sign up for an appointment. You can visit our website at kingdom-hcs.org or just Google the Kingdom Healthcare System and you'll see our website. You'll definitely see my face on the website, so you'll know you're in the right place. And you could schedule a clinic visit. You just click on the button, schedule clinic visit. Or if you have a question, you can click on the contact button where you can send an email. And another event that I would like to highlight that's coming up very quickly is our back to school physical event. So we're partnering with Community Bible Church on Saturday, August 8th from 10 a.m. to 2 p.m. And we're going to be providing free physical exams for students who need back to school physicals. We're also going to provide there'll be an ice cream truck or ice truck, something sweet and fun. And there'll be games for kids to participate in. We'll also be scheduling patients or individuals who'd like to see a doctor. We'll start putting patients on our schedule. And these appointments currently are free of charge. So if you'd like to get a checkup, have some, have your questions answered, or you need medications refilled and you don't have access to your primary care doctor, or if you just need help navigating the healthcare system, you could come speak to us. We have expert physicians who are there to help serve you. And this is simply to show the love of God to all people through healthcare. So Saturday, August 8th at the Kingdom Healthcare System, we'll be providing free physical exams, and you'll have an option to schedule an appointment for medical services as well.
Wow, that is a lot to offer. I mean, when you say you can schedule an appointment and it's free, and we don't hear that too much nowadays.
Yes.
We don't hear it at all. So you're there to help. What I like about it is you have resources coming there that people come talk to people. It isn't like you got to go somewhere. You got to pull a ticket, stand in line, and wait for number 12 to be called. How they do things now, but you actually, to me, this is something like old school used to do. When they had things open, they invited the community to come out, just show up and support. So this reminded me back in the late 60s and 70s when they did have these things. It was mainly the community center that did this, and some churches did this. So with you reaching out like this, um, who are you planning on touching? What people do you want out there? I mean, you want all, but mainly the ones I'm looking at the ones you focusing on. To this, is just my own personal opinion, is the one who cannot afford health care.
Yes, I'm focusing on the people who know they need services, but they don't have the finances to get the services, or people who've been scared to actually venture out for whatever reason. They don't want to go to a healthcare professional. So I want those people to have a safe space where they can ask their questions, get medications refilled, and that we can pray for them. And also, I've been remiss in mentioning we're also working that Saturday with the Bear County Healthcare Collaborative. So they're going to be bringing screening services. So you'll be screened for high blood pressure, diabetes. There'll be some dental examinations as well. So there will be a lot of services that day on that location. And it's a perfect joining of community, faith-based community, nonprofits, city and governmental helping city and governmental funded programs working together to serve the community, because one person can't do it all. And that's why I'm very grateful that God continues to send partners with like-minded mission of healthcare. And it doesn't matter where you are in the service industry, whether you're faith-based, nonprofit, governmental, or business oriented. We all have a desire to serve, and I believe God is bringing us together so that the sum of all parts is greater than the individual parts.
Yeah, and that's so important right there. Now you mentioned that all parts are coming out there. I think one of the key right there. My sister told me this years ago. She said the key to your good health is not only eating right, but make sure your teeth and everything is in good shape. Because that that alone, she said, starts a lot of stress. Because she came down here to I can't think of the base. She came down here for training for dental, and she came back and told me a lot of people don't realize that your teeth is a key to health too.
Yes, I do have a sister-in-law who's a dentist, and oral health is very important for your overall health. You can diagnose a lot of conditions just based on your oral hygiene. So it is a marker of what's going on in your body, and it's important to take care of your teeth because that's where nutrition starts. It has to enter somewhere, and if that's not in order, nothing else can get in order. So yes, your oral health is part of your health.
So let's get back and talk about the medical side of it. Um, Being African American, we have told, especially the men, we've been told, suck it up. Don't worry about it. We self-diagnose ourselves. Oh, I'll be okay with this right there. So then when the time you go to the doctor, sometime it's too late. So as part of education, the community is about not being afraid of going to the doctor.
Well, there shouldn't be a stigma about healthcare. And I don't think for primary care, I don't think there's a real stigma, but I do think there's a real stubbornness and just not participating that a lot of times we just want to put things off. We're going to worry about everybody else. And it's not restricted to black men. It's everybody. If you have responsibilities in life, if you're a parent, if you're uh, a busy employee, a busy business owner, a caretaker, you end up putting your health last. But the problem is when you put your health last, it deteriorates. If you ignore it, it will go away. And then it becomes an emergency or a crisis where you have to focus on it. So let's not get to that point. Let's make that part of our normal rhythm, our annual rhythm, where we go to the doctor, we get a checkup, or if we notice something's off in our body, let's do something about it. And also, we want to empower people to take charge of their health. Health is not simply going to a doctor and receiving a pill. That is a form of healthcare, but that's not really the design for healthcare for your life to live a long and healthy life. You want to take preventative measures. You want to have a healthy lifestyle where your food is medicine, your living is medicine, and that you don't want to be dependent on coming to the doctor when disease has manifested and progressed. And yes, our Western medicine, we're very effective at treating you in the middle and end stages of disease, but there's not a huge focus on the prevention or the early stage or the
Yes.
education because those are the intangibles that take time, that take motivation, that take explanation. And that can be very hard to do in very short appointments or in systems that are not prioritizing your your primary care, but are prioritizing more of the procedures or more of the management of complicated illness. And my personal opinion is I want to get to the point where we're not dealing with these end stage manifestations of disease. I want to get ahead of it. And the only way to get ahead of it is to start reaching out to people and having people come to a safe place where they can ask questions and make it easily accessible.
You said that a safe place. That's a good thing because to me, being a safe place, you can say what you want to say, and they should listen to what you have to say. But you said one point that your body, you should know your body. Trust
Yes.
me, I know mine. If I'm not feeling good, I'm not feeling good. And if it goes for maybe 2 days, I say I gotta go to the doctor. I don't know if 2 days is what I should do. Should I go right away? But the things you could do. You know your limits, and some people go beyond those limits. And when they go beyond those limits, okay, there go that tear in your shoulder. There goes your knee. There goes that. So knowing your body, you should know your limits too.
Yes. And you know what? I'm a big believer in still pushing your body, exercising. I don't want everybody to live in the comfort zone. There's no growth in comfort. And if you're not happy with where you're at physically, mentally, then you have to start changing something. And that change is going to lead to some disruption and some resistance. And that's good for you. So not every ache or pain or every discomfort is a bad thing. Now, random discomforts that affect your activity and your ability, yes, you need to check that out quickly. Don't ignore the chest pain or the blurred vision. Don't ignore that or the dizziness. Please don't ignore that. Seek
Yes.
help sooner rather than later. But everything else, if you started exercising and you notice your joints hurt a little bit more, or you started changing your diet and you're withdrawing from sugar and you feel a little more tired, slug, like that's okay. Your body has to adapt to certain changes, and it will get better.
I hope my wife is listening right now because
Hey,
sometimes.
don't put me in between that,
Oh
man.
no, no, I'm not gonna do it. I'm gonna say some days I be sitting in my chair. I so busy, and I sit in my office chair and I doze off. And she said, "Something wrong with you?" I said, "What you mean? You doze off?" I said, "I think I got the right to doze off if I'm tired." but she know what age I am, and she see things, and I said, "Trust me, I'm fine. If something was wrong, I will go to the doctor." But sometimes I'm gonna tell you, them power naps are good.
Hey, I got three boys. Those power naps hit me whether I want them or not.
Oh, yes, they do. They do. So, I want to get back to what you got coming up.
Yeah.
With
So
all the,
Saturday, August 8th, we're
yeah,
having CBC. They're going to be bringing ice cream truck or an ice truck. There'll be games. They'll be canvassing the community, sharing more information about the nonprofit and other services for the community. We'll be offering back to school physicals, and we're also working with the Healthcare Collaborative, and they'll be providing screening services for the public. So, some dental screenings, some health screenings for high blood pressure, diabetes. And the goal is to identify patients who may need a higher level of care and we can schedule them right then and right there for the appointment at the Kingdom Healthcare System. So it's a beautiful combination of the faith-based community, nonprofits, and city organizations working together to serve the community. And it'll
mm,
be 10 a.m. to 2 p.m. on Saturday, August 8th at the Kingdom Healthcare System, located on 4025 East South Cross Boulevard, Building 1, Suite 5, San Antonio, Texas, 78222. And you could just Google the Kingdom Healthcare System and you're going to see our site pop up.
hey, you can't miss it because when I was out there, you can't miss it because if you're coming from one direction, you look towards the right, you'll see everything right there. Trust me, you can't miss it.
And we do have a nice big billboard on the building, so
Okay,
you know you're in the right place. There's a lot of buildings, but if you
it
see that
is.
that blue and white cross, you know you're in the in the right place. Just keep driving. You'll see the crowd of people.
And I'm looking at my calendar, and I have nothing in the morning to do, so I'm gonna make a notion to swing out there.
Oh, that would be phenomenal. That
I'm gonna
that
take
would have
time out
so
to swing out there and just to see what's going. I know what's going on. You're doing good for the community, and we need more like you out there that's doing things for the community because these are hard times and tough days.
well, healthcare it's important. It's important, and it's a maze at healthcare with insurance. Insurance premiums continue to go up, and it seems like you pay more for less. It's more confusing. You don't know who's seeing who. You don't know who your primary care doctor is or your primary care provider is. Everybody goes in a circle, and you realize you're not getting much better. And a lot of people just disengage, and it can be very frustrating. But there are alternatives outside of insurance, and it doesn't have to be prohibitively expensive. Right
Mm-hmm.
now in our phase for our nonprofit, it is currently free, but we want to create something sustainable that really serves the community at a very high level at a very affordable price. But the first things first is getting people access, getting people in the door, getting people treatment. So we're in Mayday mode. We want to get those people who've been off their medications for 6 months because they can't afford a $200 appointment for a $4 medication. We want to capture those people and let them tell other people that we exist. As we start building momentum, we're going to be able to serve at a higher level. And that's why this year we're doing our first annual gala, Light the Way Gala, on November 19th from 6 p.m. to 9 p.m. It's on a Thursday evening at the end of the workday. So a lot of you should be able to make it. You can visit our website, and there's many ways you can participate. You can be a sponsor, you can purchase a ticket, you can purchase an ad, but just visit the website at the Kingdom Healthcare System and you can learn more about our gala. Very excited about having this event where we're going to be able to raise funds to serve you.
Oh man, yeah, I'm definitely gonna be there.
Yeah, you're part of the music and the DJ, so you definitely need to be.
Yeah, I think I'll come there and bring a speaker or two.
Yeah,
So, any closing words? Any way people get a hold of you to let everybody know?
Yes, so for our nonprofit, visit the Kingdom Healthcare System. It's kingdom-hcs.org. And one thing you can do right now that would be extremely beneficial is just follow us on our social media. We have Facebook and Instagram. And Ron, if you could put our website in your in the chat list or put it up there, but QR, well, you can't do a QR code on the radio, but just have people sign up to our social media because we announce our events. And if you go online, put your email, you could join our email list, and you won't miss a clinic day or any of the services. And on our website, we have our events that are coming up. So you could just look on the calendar. You'll see that on every Monday, 10 a.m. to 2 p.m., that's where we're at. We're just here serving the community. We have wonderful volunteers who donate their time to serve you. So please follow us on social media, visit the website, become part of the Kingdom family, sponsor the gala, purchase a ticket for the gala, advertise, or just donate. And you can be a big part of healthcare change on the south side of San Antonio.
Okay. Do you have a flyer on what's going on the 8th?
You know what? I will post it and I can send it to you.
Okay, go ahead because I just posted your website, but I want to have that flyer on there so everybody know what's going on.
Okay. That would be fantastic.
Yeah, help get that word out. And any flyers for your event, your gala event coming up.
Yeah.
I think I
Those are
already
on the
did something
site.
on it already, but I want to keep everybody informed what's going on. We don't want this to just after 3 days nobody know about it. We want to make sure that everybody's gonna know what's going on.
Yeah, so I'm gonna post this nice little interview, this advertisement for Saturday, August 8th, where we're serving the community. We have the
Okay.
Healthcare Collaborative, Community Bible Church, and the Kingdom Healthcare System working together to really serve the community, provide healthcare services, and more of a continuum of care because it's not just screening. If you screen, you see something you're unhappy with, now you can schedule an appointment and we can start you on your health journey
There
with or
you go.
without insurance.
There you go. That's what I like hearing. Oh, I love hearing that. All right, sir. You take care, and it was good talking to you. And we'll see you on the 8th.
All right. Thank you so much, and God bless.
All right, bless you.
Bye.
Recording stopped.
All right, everybody. That was my man, Dr. Musa, and you're tuned in to WSAN Radio.